Hi guys, welcome back to another episode of A Little Help for Our Friends. Today we want to talk about a topic that's really sad and really difficult, but also one I think needs to be talked about, especially, and one that people have a lot of questions about, and that's suicide. So this is something Kibby has some experience with and is going to speak to, and it's something actually my followers reached out to me and talked to me about. And so we have a follower story to read. I think it's just a really nice example of how suicide can affect us differently and in different ways, and sometimes unexpected ways. And then we have an absolutely fabulous guest. Her name is Dr. Kate Bentley. She's a Harvard professor, and she's going to give us she's going to give us a lot of information, but a lot of what is exciting about this interview, and full disclosure, we did the interview before recording this part, so that's why I can speak to it, is that she really helps us understand how to help our friends who are in this situation. Because talking to my followers, I noticed two big trends and questions about suicide. One is, you've noticed that a friend is saying concerning things, or they're even maybe putting out messages on social media that are a little bit cryptic, a little concerning, and you're not sure what your role should be. Maybe it's a family member, maybe a friend, and it's like, well, what's my role in all this? I'm not an expert in mental illness. I don't know anything about suicide. How can I help? And so I think Dr. Bentley is going to be really great at helping us understand that. And the other is just talking about the range of emotions that occurs after suicide, and a lot of guilt and a lot of anger that comes up. And so I think the follower story kind of speaks to that a little bit. And also Kibby recently had an experience that she will talk about as well. So Kibby, if you wanted to take it away and kind of talk about what you went through.
Yeah, I mean, for confidentiality's sake, I won't say who it is, but I recently lost someone to suicide a couple months ago. And, a lot of people listening now might either experience some suicidality or suicidal thoughts or behaviors themselves, or know someone. And for both people struggling with the suicidality and those around, it's so hard. So I absolutely, my heart reaches out to people who might be struggling with this. But I'm going to talk a little bit about my experience, just because I think it would be useful to get out what it's actually like to have a loved one die by suicide. This person I cared a lot about. Didn't know them for very long, but I cared a lot about them. And this person struggled with suicidality, like thoughts. And I remember one of the things that I said to this person was, please don't do this. If you do this, I would be devastated. And that person looked surprised and said, because of that, I'm not gonna hurt you like that. Yeah.
That's really powerful.
Yeah. But then a couple weeks later, a bunch of unfortunate events happened, and I just remember getting the call from the police with the news, and I don't know. I blanked out. I remember crying, and asking, "What do you mean? What do you mean?" I went into like this kind of state of shock. My brain couldn't put the pieces together. It seemed like a dream. Luckily I had good friends nearby, super supportive. Thank goodness, because I was in a fog. I remember that week didn't feel like anything. I went into this adrenaline state where I was really awake and weirdly on top of my work and really engaged, but felt no emotions. And I thought about it intellectually, but I didn't feel the sadness that I thought I would. And I remember one of my mentors said, "It sounds like you're in shock, Kibby, so I'll check in later." And she did. And the next week I went into more of an anxiety state. Like I was shaky. I was terrified of everything. I didn't want to leave my house. And it was so weird because it was just this floating anxiety, but I've never really experienced that to that extreme, but I was just afraid of everything on the street. I was afraid of going out outside. I think I even talked to you during that time that there was some, yeah. And then after that, I felt more sadness. Like I talked to the person's family, and it was just a really wonderful way to grieve together. But it for people who are listening, you can't imagine the pain. Like you can kind of imagine it, I'm sure, but it is devastating in a way that I can't describe. Like, as a therapist, we have all the words to describe these things, but it's just this pain that just sits with you, and you feel powerless, and you search for moments that you could have done things differently, and you look back on the interactions, and throughout the day, a conversation that you had with that person popped up, and it almost seems not real, because it's so sudden in some ways. It was for me. And yeah, and I think what people might not understand, and Kate talks about this really well, is that it affects so many more people than you think. Like you might, for people who are thinking about suicide, it's so hard. Sometimes it feels like an uncontrollable thing for them. Like they have these thoughts, and they know it would be terrible, but they can't help but think about it because they don't. Usually, it comes when there's like a lot of stress, and people can't think of alternative ways to help themselves, so they just think of this one solution, especially when times of intense distress. So I totally get it. I sympathize and empathize with people who might struggle with this. At the same time, like please don't do it, because people struggling with suicide might think of maybe a couple people, like, your parents or a spouse or a partner or whatever, a kid who might suffer, but it ripples out the pain. Like people that person didn't even know. Several people were affected by it. People that I had talked about, people that the person's families talked to. It just is like a wave of pain, and I really do think it changes me for longer than I probably know. I mean, this is several months later, and today I just thought of that person, and I did notice that I'm more scared of loss. I'm more scared of losing people. It's affected me, and in ways I didn't really think about, and that person probably didn't think about. So,
yeah, and first of all, thank you for sharing that with our audience and with me. I remember what a horrible time it was for you, but I didn't know that it went that deep, and I think part of that is there's a kind of detachment. I think often when we think about suicide, it just feels so unprecedented, like one of those things that would never happen to you. It's like, it really is like its own form of trauma, something that when it does occur, it's like shakes kind of the foundation of your entire life, and suddenly ways that you felt safe by default before are ripped away in the same way that it is with trauma. And I don't know if people realize that. And the other thing is that I think when people are suicidal, they lose touch with how many people do love them, or they really underestimate the effects that they'll have on other people, because I think it can come to a place where they see themselves as unlovable or hopeless or worthless, and so it can be difficult to square that with, wait, all of these people love me, like 70 people, 100 people, 300 people, like all these people are really, really deeply affected by this hypothetical loss. And so it's such a disconnect between how we see them and how they maybe see themselves. And
it was a crazy experience, because all throughout our training, like we train in dialectical behavior therapy, the main treatment for suicidality. And so I learned about suicidality. We trained a lot in how to deal with it. talked a lot about how we might experience it in our life, to lose someone to suicide. And, so there's a part of, of all the people, I might be the one or one of the few who might be the more prepared than the people listening. And still it rocked me. It sits in my heart. It comes up once in a while. It leaves a residue of pain. Yeah.
So I know there are a lot of therapists who listen to this podcast, and I just wanted to get your input on what it's like being a mental health professional and therefore maybe feeling more responsibility for people who are in this position, for friends or loved ones who, what is it like to feel that responsibility and then to have had this go on or happen?
That's a really good point. Especially because, even for people who are not therapists or not professionals trained in this, hear Kate talk about like making sure you get help, right? Professional help, which is us. It doesn't get easier. It's not like I will ever, just because I had these experiences, it will never be hard. It's a lot of responsibility. It's a lot of, I work with we work with a lot of people who have these thoughts, and there is an element of fear, like an element of, they said something the other day in a session that you're like, oh my God, like, wait, what? You have a bunch of pills and you think about it sometimes, like it's scary. It's really scary. Mm-hmm. And I think what helps is that people who do work with people with suicidality, the best, and I would say for me, the only way I would do it is with a team-based approach, right? Like with other therapists, that's why DBT has like a team-based approach, like other people to support you, other professionals there. Doing that alone and having that responsibility alone would be unimaginable. So
did you ever have, and I'm asking because this is a question that came up several times from followers. Did you ever have any emotions or reactions that you were ashamed of, like feeling angry towards them?
Absolutely. Yeah. Mm-hmm. I don't say I was ashamed about it, but I was less aware of it. And when it came up, I was confused by it. But this anger, especially because I communicate like, please don't, this will devastate me. And then the person did. So of course it's not about me. Of course there were other factors that were, loomed larger in that person's mind than that. But it did hurt. It did hurt the people around them. And anger is a part of grief. It's a way to, respond to feeling so hurt and so much pain. And the thing is that with death, there's no one to be mad at, right? There's no one to say, why did you do this? Why did you hurt me like this? So you're kind of left with it. And you have so many fond memories, and when someone dies in general, you have so many fond memories of them, but then you also have this other part that's like, why did you do this? So it's hard. Yeah.
I think especially too, because when this happens, you're so unprepared for it and no idea how it's really going to affect you, and how, I have some idea, if one of my siblings took their life, like I would, or my parents or my boyfriend, or I would be absolutely devastated. But even the term absolutely devastated, like, what does that mean until it happens? There's something I just don't even know. And so I can imagine having that happen and then being plunged into that despair and agony. I could see how my brain, my body would be angry about that. Like, how could you do this and not know the effect that it would have? Or how can I'm in this state and I feel so helpless and I don't know how to get out. Mm-hmm. And so anger, it kind of makes sense, but it's also an emotion that I think people feel really ashamed of or really guilty of, because obviously they know the person who did it wasn't trying to hurt anybody else. In many cases, they think that they're going to help other people through this act. And so it's difficult to both grieve someone and be angry with them.
Yeah, and then there's this piece of the idea that they have agency or choice, right? Like my father passed away from cancer, and that was a different kind of loss. It was like he didn't want to die, or it wasn't by his own hand, right? And I think with like something like substance abuse or suicide or other kinds of deaths. There might be an idea of the loved one, or the loved ones might think of it like, you chose to do this. You did this on purpose. You could have not done this. And it's really hard to say because people struggling with all of those disorders don't feel like it's a choice, right? They feel like that's their only option. Sometimes they feel like it's automatic. They couldn't even control. A lot of people die by suicide impulsively. So, but even just for the loved ones, feeling like you could have stayed alive is hard.
Well, and when someone dies by natural causes, you're angry too. You're just not angry with them. You're angry at the cancer, but in this case, it's like, what can I be angry with? My only answer is that person, or fate, or depression, I suppose. But
really good point.
Yeah. Okay. Well, I will read the story from our follower. I just thought it was really, really nice of her to share this with us. And this person lost her older brother. And this happened 3 years ago. And she just kind of describes different ways that this loss has affected her and her family, and kind of just brings up some issues that we might not think about at the outset about how this affects family structures. But so she says this happened, and suddenly she became, I'll read from her words. Suddenly I became the so-called oldest sibling. My brother who passed away was always so great at handling family matters, and I knew I could always rely on him. I now feel this shift. I also felt an overwhelming need to be there for my parents in the aftermath, so as a result, I pushed aside my own grieving for most of the first year. It certainly has led to feelings of hypervigilance and even PTSD within my immediate family. We are constantly in fear of something else happening. Everyone grieves in their own way, which also complicates matters. I'm lucky to have such a close family, but even then we don't always know what each other needs. So there's that kind of reference to trauma again, actually, about how the reaction to this can really feel like a PTSD reaction. And talking about the same, you mentioned hypervigilance when this happened to your loved one. So hypervigilance within her family as well. And then also how her own role within her family suddenly shifted. I think we have such strong narratives around sometimes like who we are in our family. I'm the youngest child. That's been I kind of understand myself within that structure, and suddenly she had to take on a totally different role. She said, I want people to know that it's okay if the grief journey takes a long time. My family is almost 3 years out now, and it still feels like it happened yesterday. We have found a way to live within this new family structure, but it's certainly not easy. Every day I think about what my brother is missing, how he'll never meet my future husband or future children. He never even got a chance at having a family himself, which is something he always wanted. And she says, but there's always hope, and we see signs that he's still with us every day. We're now in a stage of figuring out how to carry on his memory, although he cannot be here physically. And then, so, I asked her if there was anything else she'd like to share with people, anything she learned through this, and she said, she really appreciates sharing his story because she's found it's a good way to keep his memory alive and to raise awareness. And so that's just to say that, sometimes sharing and keeping his memory alive can be a really important part of coping. She said, I would also like to share with others that it's okay to feel the range of emotions, and you likely will. So anger, sadness, fear, guilt. And that after time has passed and from reading a lot on suicide and mental illness, I know it wasn't my brother's fault, and that depression and other forms of mental illness can unfortunately be terminal. And then she ends just by saying, and here she's talking about herself, I've heard the quote many times, you are walking along a path that went right, and all of a sudden you're forced to take the left side. But we can learn how to make the left side special and unique in its own way. It's helped me get involved with organizations like AFSP and to join support groups for other survivors of suicide loss. So, it's interesting because this person is, on the one hand, this is still really fresh. She says it's felt like it happened yesterday, even though it's been 3 years away. And on the other hand, it seems like she's kind of moved through a lot of the grieving process, and she's come into a place where she is finding connectedness with others and finding meaning and figuring out how to kind of keep his memory alive and use that to cope.
Yeah, I think that's such a beautiful story, but also highlighting, that the scope of grief where you, in the beginning, it does feel like, you're in shock, it's a trauma. And then over time, how we get through trauma and grief is to find meaning in it. And I think it's so beautiful that this person wants to share the story. And instead of like, it could be isolating for loved ones who has someone die by suicide. It could be isolating for many families. It could be a lot of shame, especially a lot of religion. Different religions might regard it differently. So a lot of people might suffer in silence and alone, and might even tend to lie or say that they died in some other ways, and that could be really lonely. So I'm glad this person is taking a different route.
Me too. Well, thank you again to this follower who shared her story. I really, really appreciate it. And I suppose now we can go ahead and introduce Dr. Kate Bentley. So this portion is really for people who have questions about how to help and what kind of resources are available and what seeking treatment for suicidality can look like. Okay, well, we are thrilled to welcome Dr. Kate Bentley onto our podcast to give her expert advice and research knowledge on suicide. Dr. Kate Bentley is a clinical psychologist at Massachusetts General Hospital, and she is an assistant professor at Harvard Medical School. She has an expertise in suicide prediction and prevention, and she is also a clinician, so she mostly treats patients with depression and anxiety and self-injurious thoughts and behaviors. So welcome, Kate, Dr. Bentley, and thank you so much for joining our podcast and telling us what you know.
Thank you both so much for having me. I'm thrilled to be here.
So I know you study suicide prediction. So how can loved ones kind of see the signs in someone who might be suicidal? How can they assess that suicide threat and maybe broach the topic with someone they're worried about?
Yeah, this is a great question. So when we're thinking about, if you have a loved one who you're concerned about, maybe you have the sense that they're, becoming more depressed or experiencing, some increased mental health symptoms, or maybe there's an indication that they're suicidal. I think the first thing that's really important is to assume that you are the only one who will reach out. Sometimes people might think, oh, well, is this my place? Am I the best person to be doing this? It's really important to assume that you are the only one who will reach out and do that. If you're concerned, so, some warning signs that, we often think of are things like really notable changes in behavior. So maybe your loved one is starting to, withdraw more, not spend time around other people, increase use of substances, act recklessly, maybe sleeping way too much or way too little. And obviously, if they're starting to talk about things like thoughts of ending their life, thoughts of suicide, not wanting to be here anymore, those are really important signs that that they might really be struggling, and it could be really valuable, even life-saving, to check in with them. I always encourage people to think about having an honest and a private, of course, but really an honest conversation with their loved one. Asking them, what's going on? How are you? I've noticed that you seem different than maybe, how things have been before. Even if you open the conversation in a more general way like that, assessing how they're doing, probably the most critical thing is to, if you really are concerned about someone's mental health or that they're suicidal, to ask them directly if they have been having thoughts that they don't want to be alive or thoughts of suicide. There can be this misconception, and I think that's understandable, that if I ask someone about that, is it going to make them start to think about it, or is it going to make them more likely to act if they have been thinking about it? We now have more and more research to show that that's not the case, and it's now considered best practice and critical, even life-saving, to actually directly ask. Once you have asked if that's something that your loved one is experiencing, try to not act shocked or surprised or angry, even if they say yes. Having those reactions, even if they're understandable, maybe you are really surprised, maybe you are shocked, maybe you are even angry or you're frustrated with them. Those types of reactions can communicate to that person that they shouldn't be feeling this way, that they shouldn't be talking about this. You want to communicate to them that you're not going to go away, that you're there for them and you're there as a source of support no matter what they're going through, and that this doesn't need to be something that they're ashamed about. I think as the person hopefully starts to talk with you about what they're going through, it's really important along those same lines to listen. Try to just listen to what they're going through. You can ask them more questions if it feels appropriate about how they're feeling. Try to validate what they're going through. We think of things like, it must be really hard what you're experiencing right now. Gosh, I'm so sorry that you're going through this, right? Even if it's really well-intentioned, sometimes people can have this pull to try to make the person feel better immediately, or to say, all right, let's try to problem solve, let's try to figure out how to make this better. Can you try to think positive, these sorts of things. And even though those may be very well-intentioned, that's often not what someone who is really struggling or is suicidal needs to hear. I think the single most important things are to communicate to that person that you care about them, you're not going to go away, and they're not alone. And I think maybe we'll talk a little bit more in a little while about what to do if you have the sense that someone is really immediately suicidal and you're immediately concerned. But these are just kind of general ideas of if you have a thought or a sense that someone's really struggling and maybe they're starting to think about suicide.
That's amazing. That I love that you also give examples of what to say and to talk about things directly. Because one, I know that people might be, as you said, afraid of suggesting that, like inserting that idea in their head. But also, even just some people might be afraid to even broach the topic because they might be afraid to hear the answer of, yes, I am suicidal, thinking killing myself. And it's such a hard balance to validate what they're experiencing, but then also really not validate the actual choice to kill themselves. Because talk a little bit about that, because I imagine, even as clinicians, sometimes in those situations, if someone mentions that they're feeling suicidal, my first reaction is, no, don't do it. No, get rid of those. Let's get rid of those thoughts right away. It's hard to validate without, and also have that hard line of, please don't do that.
Yes, definitely. And I think that's a subtle distinction, and a really important one, that it's about validating, typically, right? I guess, generally it's about validating that they're struggling, that this is a really hard time for them. And, I'm thinking more like clinically, right? And as you're saying, Kibby, we might even say things in a clinical setting along the lines of like, when we're really struggling, it makes sense that we would, have thoughts like that. Though we want to be really careful to not sort of normalize, right, that experience in a way of saying, this isn't something to really be worried about, right? Or it's okay, or this is not that it's not normal, it's something that should be ashamed about, but this is, such a main point that if someone's having thoughts of suicide, it's extremely important that and you can help them with this, try to get professional help. So this isn't normalizing by saying, oh, well, okay, this isn't a big deal. A lot of people experience these thoughts. This is validating that they're struggling, and then taking it very seriously and thinking about, okay, what can I do to help you get the support and the resources that you need?
One thing that I encounter so often is people thinking that suicide threats are calls for attention. Is that ever true? And how should we kind of approach these situations where there's this suspicion that there's a call for attention, or should that never even enter our minds?
That's such a great question. It's a complicated one, and two primary things really come to mind for me. One is that if someone is making suicidal statements or engaging in suicidal behaviors, those thoughts, those actions should always be taken seriously, no matter what. I see this too, people sort of writing it off and saying, oh, well, they didn't really mean that, right? Or they were just trying to get attention. Suicide is extreme. This is extremely serious, right? This is perhaps one of the, if not the, mental health outcome that we're the most worried about, and it's, the most serious. So if someone's making, what people might think of as calls for attention or threats of suicide, those need to be taken seriously no matter what. Don't downplay it or don't write it off. There are cases where someone might say things or do things to lead someone to believe that they're going to take their life when they have no intention to. This is, I think, rarer than, might be discussed, as you're saying, Jacqueline. We call these suicidal gestures. Even in those cases, though, that person is probably in extreme amounts of pain, and is maybe desperate for other people to see the pain that they're in or to find a way to change their situation. So even if, this isn't, as common as I think people think it is, but even if someone is making statements where, they actually really don't have any intention to end their life or aren't seriously thinking about it, I would still handle that probably in the same way that I would if I had the sense that this was something they were really thinking about, is validating what they're experiencing, that they're struggling, letting them know they're not alone, you're there for them, and trying to connect them to professional help. I've heard, you both talk about this on your podcast before, this term like manipulative. And as mental health professionals, we tend to not like that term, right? Or use that term. It can really sort of take away from the pain that someone is in that is potentially leading them to make suicidal statements, even if they aren't feeling that way. But I think, or they aren't seriously considering it. The most important thing is to take those statements seriously, even if you are questioning, would this person actually do it, or are they seriously thinking about it?
Yeah, and to follow up on that, how can you tell loved ones to be able to distinguish between suicidality or suicidal acts or behaviors and non-suicidal self-injury? Mm-hmm. Because I can imagine that without kind of like expert knowledge on this, if they see someone harming themselves in any kind of way, how could they understand the difference between the two, or is there a difference?
Totally. Yeah, this is another really great question, and something that I think, even over the past, 20 years or so as researchers, we've gotten a much better understanding of these behaviors. So, sort of definitions wise, non-suicidal self-injury is any kind of deliberate destruction of one's own bodily tissue. So sort of deliberate acts to hurt oneself directly, without any intention of ending their life or killing themselves. So, there are common forms of this, right, that we all are probably familiar with and hear about. The important thing about non-suicidal self-injury and SSI is that there is zero intent. The person has absolutely no intent to kill themselves, either directly or indirectly, by engaging in this behavior. Whereas suicidal actions, behaviors, etc., there is some level of intent. So there, is an intent to actually end one's life. That can not be, a super high level of intent, but even if there's a little bit of intent there, like maybe by doing this, I might, kill myself, we would consider that suicidal. But this can be really hard to assess. It can be hard to assess for clinicians or researchers who study this all the time and are constantly working with people who are experiencing these problems. Nonetheless, right, not, of course, a loved one who is, maybe not an expert in self-injury and suicide, and also doesn't have years of mental health training. So this can be really hard to distinguish. And it can also be hard to distinguish because a person's description of why they engaged in a behavior, if it is something that happened in the past, that may change. They may say, because either that really does change in terms of, sometimes they're engaging in a behavior for this reason, sometimes they're engaging in behavior for another reason, or there may be motivations to say, no, that wasn't, I wasn't trying to end my life, it was just this or that. Either way, non-suicidal self-injury in and of itself is also a fairly, a problem that we're concerned about as clinicians. Non-suicidal self-injury is one of the strongest predictors that we have that someone may, not, but may go on in the future to make a suicide attempt. So even if a loved one is, seeing, maybe a family member, friend, a child engaging in non-suicidal self-injury, and they have strong confidence that the person isn't attempting to kill themselves, that's still something that warrants clinical attention and is important to talk with them about in that sort of direct and honest way that I was speaking about before, and involving professional help.
That's great. Yeah, I find that it was specifically hard with, let's say, drug abuse or something, something where, if, as a clinician, if someone is, using heroin or some other really dangerous drug or opiates that they're taking it without the intention to die, but knowing that one day it might lead to that, and sometimes that's really hard to tell. Is that person suicidal or is that person? Yeah, it's tough.
Yeah, it can be a really tough and sort of a blurry line. And this is something that, researchers are trying to sort of better understand, better pinpoint. And there's a lot of overlap between, in the behaviors you're mentioning, Kibby, substance use, drug use. As clinicians, we're obviously concerned about those types of behaviors, even if someone's saying they're not doing them, right, for the explicit purpose of ending their life, because we tend to see that for people who are engaging in more types of behaviors like that, maybe reckless behaviors with the potential of ending their life, even if that's not their intention, that is putting them at risk, right, over time.
Yeah, I mean, when the distinction is intent, that's incredibly difficult to figure out, because how can you read another person's mind? How do you know if they're telling the truth when there's so much shame around this topic? So,
Yep. And also a quick point, and the person themselves, it may not be, people don't tend to think this way, right? Like, do I have 10% intent that I'm going to do this, or do I have 0, or people who are engaging these behaviors may not, we're probably not thinking about it that way, tend to be very high levels of emotion going on, really in crisis.
Impulsivity.
It can be hard to pinpoint, right? Impulsivity, exactly. Yeah.
Okay, so at what point do you step in with treatment? Like, actually, if we could walk through, I had a friend once call me who was saying that she was suicidal. And it wasn't in the first 5 minutes of the conversation, but that kind of came out. It was a lot of questioning. Essentially, she was in a emotional crisis. This wasn't something recurrent. I'd never had this conversation with her before. But she wanted to talk a lot, and I became really confused about when I should step in and how, and then what the options were for that. So, like, at what point in the conversation do I stop talking to her and call the ER? Or is the ER the right place to call? And what's the best option for her? Eventually she did go to an inpatient unit, but I that was like other people got involved. So what's the kind of plan of action, if there is one?
Yeah. This is perhaps one of the hardest things that, as a friend or a family member, right, and even clinicians, actually, that we are constantly sort of grappling with, is what level of care, what care does this person need right now? And we may talk about this a little bit more later on, but there's still a lot we need to know and better understand about when someone is at the highest risk for actually engaging in suicidal behavior, but we need to know a lot more about that. So in this moment, sort of with the knowledge we have right now, after, some of the things I was mentioning before, like listening to the person, having this open conversation, validating what they're going through, letting them know you care, they're not alone. If a person is saying to you that they definitely, if they've started to take any actions towards, actually ending their life, that could mean actually doing things to hurt themselves. That could mean starting to plan what they might do, really kind of think through, any details about what they would do. Or if they're just saying that they're really seriously considering, taking their life now or soon, you 100% will want to think about involving professional help. And there's this, there can sort of be this decision point of, at what point do I do that against this person's wishes, right? The first thing that we always try to do, whether it's, you're a family member or a friend, or you're their clinician, is if you think that someone might need more support, is to ideally get them on board with that plan of action. So thinking through, if your loved one already has a therapist or psychiatrist, asking them if they've been in touch with that person. Does that person know what's going on? Just because a family member or friend is seeing a psychiatrist or a therapist doesn't necessarily mean that that person knows, both because there are obviously many motivations that people can feel to not disclose thoughts of suicide. Maybe they're concerned about what the consequences will be. Will that provider make me go to the hospital, make me go to the ER, et cetera? And what we know from increasing amounts of research is that suicidal thoughts can fluctuate very rapidly. So someone may not have been suicidal when they saw their therapist a week ago or 2 weeks ago or 3 weeks ago, even a day ago, but that may have changed and that may be different right now. So encouraging to, if they have existing professional supports, that's wonderful. If they don't, I think one thing we can do is to help them try to get connected to care. When someone's in crisis, the thought of trying to find a provider, Googling who takes my insurance, who doesn't have a wait list, what are the best options, that can feel extremely overwhelming. That can feel overwhelming if you're not in crisis. But that is something tangible that I think a loved one, a family member or friend can do. Those are options, right, for if you have the sense that someone's really struggling, maybe they're suicidal, but maybe you don't think, or they haven't told you and you've asked, right? Like, are you thinking about doing this right now? Have you taken any steps to do this, right? If they have, meaning they are concretely kind of planning what they might do, they've said that they've started to take some actions, or again, like having a low threshold, if they're really seriously considering that, it may be at the point where you need to involve other sources of support immediately, right? More immediately. And that could look like a few things. One, it could be making sure that that person isn't alone, like physically alone. If you have the ability to go to them, you're in the same area, et cetera, that's great. If not, maybe you're thinking about having a conversation with them about whether they're people who they could go to. Maybe those are people who they could go to and actually explain what's going on, but maybe that's also just going and being around other people who might kind of distract them, be supportive, generally, et cetera. Another thing you might be thinking about is, especially if someone said that they've started to think through what they would do or they've taken steps, if you can help them try to get more distance from or even remove access to the means or sort of to the methods or things that they might be thinking about to actually, to end their life, what they might be doing. This could be this could be involving family, et cetera. A couple other things that I think can be really important, and especially in kind of these gray areas of, is this person really seriously thinking about this right now? Or do we have a little time? Could we get them connected to therapy within the next week or the next month? There are these really great resources like the National Suicide Prevention Lifeline, also crisis text lines. The Lifeline is 1-800-273-TALK, where people can call when they're in crisis and speak with a trained crisis counselor who can help them kind of get the support they need, get through the crisis, and allow them to sort of not necessarily always put that burden, not that they, on family and friends. So it's sort of another way to get that person help. And there may be a point when you are talking with them about involving emergency services right now. That could mean maybe offering to accompany them to the emergency room, to the hospital. That tends to not be something, understandably, that people really want to do. But if you are really concerned about a loved one's immediate safety, that may be the best and really a truly life-saving course of action. Another thing that people are always sort of talking about is calling 911. If the person is not willing to go to the emergency room, doesn't want to, won't go with you, and you're really immediately concerned about their safety. This issue, sort of sending the police to someone's home, has obviously gotten a lot of attention recently, especially for minority groups, Blacks, Hispanic people. There are a lot of questions about whether traditional emergency service, there are real risks potentially of sending traditional emergency services to someone's home. So this is something that a lot of people are thinking and talking critically about now. Can we develop better, crisis emergency services? So this is a complex question. I think in general, we're sort of seeing calling 911, right, involving as the last resort, given that, especially for some groups, that could potentially have harmful consequences.
Thank you so much for giving very concrete answers and a real, sort of step by step guide in a way, because it is one of the most confusing situations to find yourself and desperate, and concerns like not wanting to put them into debt for an inpatient stay, the fears of the emergency room, fears of emergency services is running through both people's minds, and it's going to be so hard to break through that and figure out what to do. If you have a situation with kind of a chronic, someone who's kind of, I'm thinking of someone in particular actually whose brother repeatedly threatens suicide, calls her wanting to talk a lot, I think refuses treatment. How do you kind of avoid compassion burnout, or what do you do when these conversations become chronic?
This is so difficult. I think this could be handled in a similar way, or can be handled in a similar way to how we might if this was not specific about suicide. And I've, for loved ones, for people who have someone who's struggling with suicidal thoughts or other mental health problems, that can really weigh on the people who they're going to for support. And we can, maybe you're there for them time in and time out, again and again, and it can start to really wear on you, especially as you're saying, for this person, someone who's refusing treatment, right? So really they're relying on people in their lives for support. One thing that might be really important is to think about whether it is time to set boundaries. And I think that can be, when there's concern about suicide, that can be really, really, really hard to do. I think setting boundaries can always be hard to do, right, when it's a loved one, but especially if there's concern of, well, if I tell them that, I don't want, if I communicate to them that I don't want them to call me anymore, in the middle of the night or whatever it is, like, could that be life-threatening for them, right? Who else are they going to go to? That can feel so scary. Though, to be able to effectively support people in your life and to make sure who are struggling with suicidal thoughts and behaviors and to get them the help that they need, that can be really important, to say to, again, compassionately, understanding, honestly, here's how I'm feeling, and that, here, I understand what you're going through, or maybe not I understand, but I appreciate what you're going through. Here's, how this is affecting me. And what I think is really important is for, the next time you're feeling this way, could you attempt trying, to call the crisis line instead, or, being in touch with your therapist. I think have it, as hard as it can be, having a low threshold for encouraging that person to get the care that they need, because often their loved ones, even if they can offer all the support in the world, it may not be exclusively what that person needs in that moment. But this is one of the hardest. I think this is one of the hardest things.
Yeah, almost listening to you too, what sounds so hard about it is the sense of responsibility that loved one feels right away. Oh my gosh, that person's communicating this to me. If I don't do something, if I do something, will that tip the scales, and will that put them at further risk? Like, that can really weigh on a person and really just kind of lock people into terror. What do I do next?
Yeah, it can be really hard. And that's right on the heels of what I was just talking about, right? Which is how important it is to make sure that to take steps when you are immediately concerned that someone might end their life, right? And even if that is doing things that the person may not completely want in that moment, right? But that is important for them, like involving a provider, considering if they need more care. It's hard, right? When then you're also maybe concurrently trying to establish and hold boundaries. It can be a really, really tough balance.
Mm-hmm. Yeah. And even extending the topic further of effects on the loved ones. What about after someone a loved one or a family has lost someone to suicide? What are typically the effects of that? It almost seems unimaginable to many loved ones, or even the people who are struggling with suicidality. They know there's going to be a lot of pain, but can you tell us a little bit about what are the common experiences on families, clinicians, schools, anything?
Yeah, definitely. So even just what you just said, families, clinicians, schools, like I've seen some estimates that for every person who dies by suicide, that death affects like minimum of 60 people directly. And that's like direct effects, right? So this really does have a ripple effect, not only on someone's immediate family, but their communities. And some of the experiences that we, would expect a person to have, and this can be so variable across people. So really, I think any reaction, right, is normal, right? Some really common reactions are obviously extreme, profound distress, emotional pain, sadness, even experiences like guilt, like shame, a lot of what ifs, what if I had done something differently, right? What if I had gotten them into treatment sooner? Could that have changed things? Even anger, frustration at the person. These are all even relief sometimes for some people. These can all be very normal experiences. Also, there's still a lot of stigma around suicide in our society. And that can be something that so there's a term we use, suicide survivors. These are people who have lost a loved one to suicide. Suicide survivors also might be really affected by this stigma and face questions like, do I share openly with people how this person died, or do I not? These can really be complicated decisions to make. So there are a couple things I want to mention about things that suicide survivors can consider doing. One is there's some really great organizations, like one that comes to mind for me that I've been involved with for a while is the American Foundation for Suicide Prevention, or AFSP. And they offer these suicide loss support groups that can be in person, they can be virtual, but if you go to their website, you can find, support group online and in your area. Will really give people the space to talk with others who have had shared experiences and process what they're going through. For people who have lost someone to suicide, they themselves might benefit from seeing a therapist, even if that's something that they haven't done before, even if it's for a limited period of time. And one thing that I think is really important to emphasize is that there does come a point where we might want to be on the lookout and be concerned about the suicide survivor developing their own or maybe mental health problems that either they had previously and they're getting worse, or that they hadn't had previously and they're developing. And what I mean by this is that it is expected for a person who experiences the loss of a loved one to suicide to experience profound pain, distress, sadness, and potentially for quite a long time, potentially, forever to a certain degree, right? But there comes a point when if those kind of negative emotional experiences are really at an extremely severe level and really interfering in that person's life beyond a period of time that we might expect that to be the case, that we may start to think, okay, are they suffering now from conditions like major depression, complicated grief, even post-traumatic stress disorder? And does that person maybe need to consider, getting professional help for what they're experiencing now? I think on the other end, let's think about people who maybe, and we're sort of talking about this some before, have someone in their life who is experiencing suicidal thoughts and behaviors, but hasn't died by suicide. We talked some about the importance of establishing boundaries and also caring for yourself, right? And that can be a part of the boundaries, but making sure that you are, taking care of yourself, getting your emotional, physical, spiritual, whatever it is, needs met so that you can be there for that person. And I think a lot of it at the end of the day is even if the person doesn't want to, but you're continuing to reiterate the message of how important it is that you think that they seek professional help, that when we're talking about suicidal thinking, suicidal behavior, that's, I think, probably the most critical thing.
Thank you so much for highlighting the kind of the widespread effects of suicide on a community, on a group of people, because talking to some, patients or people with suicidality, often there is that question of, what would it be like if would anyone miss me? I'm a burden. And this the kind of question of your own worth in your own community. And they might minimize that. And even just to think that 60 people would be directly affected by it, that's a lot of people. You could think of the flip side, that 60 people's mental health and well-being is like, you're a part of that. You're a part of 60 people, how much they care about you. So thinking about the effects of the loss, if that many people are affected by the loss, that many people are affected positively by your presence. So thank you for that.
Yeah. Of course.
Okay, so broadly, maybe there's threats, ideation. What kind of treatment recommendation, like long-term treatment recommendations, would you suggest to look for? Again, we kind of go through this example of looking through psychology today. There's not always a ton of information, or it's confusing. What should we be on the lookout for if we're trying to get our loved one into treatment?
Yep. For someone who has experienced suicidal thoughts and behaviors, we really want to be looking for a provider who has training and experience in working with patients or clients who experience these problems, who are suicidal. There's more and more kind of options now in terms of evidence-based treatments for preventing suicide. Ideally, you would find a provider who has training in those treatments. If not explicit training in evidence-based strategies for suicide prevention, at least a provider who's explicitly saying that this is an area of experience for them, ideally an area of expertise. Some sort of treatments that we now have and we know can be effective at preventing suicidal thoughts and behaviors or reducing suicidal thoughts are forms of cognitive therapy that have been developed and tested specifically for suicide prevention. So we now understand to a certain degree that, or have a sense that treatments that have been developed, and primarily tested for, say anxiety or depression or other conditions, they may also help with suicidal thoughts, etc. But it may be more effective to consider a treatment where suicide is directly targeted, and that's a part of that treatment. So cognitive behavioral therapy for suicide prevention, dialectical behavior therapy, DBT, even brief interventions. So things like safety planning, crisis response planning. These are brief psychological interventions that involve kind of in a structured way planning for a suicidal crisis. So what would I do if I got to that point? Providers who have expertise in these treatments, I think, would be at the top of the list. There's still a lot of work to be done on developing better and more, especially more accessible, improving the treatments that we have for suicide and suicide prevention. But there is hope, because right now we do have evidence-based treatments that we know work, and getting a loved one connected with providers who do those, have expertise in them, is again, perhaps the most important thing.
Wonderful. Well, Dr. Bentley, this was immensely helpful. I am so glad we had you for this episode, and that we're doing this episode in general. I feel more equipped going forward in case these situations arise. I hope our listeners do as well. So thank you again. Okay, well, I'm just really excited we had that wonderful interview with Dr. Kate Bentley. I found it enormously helpful. This is something that, I'm in grad school for this, and it's still a confusing and terrifying position to be in. And so I really liked how she gave pretty concrete answers, and which was really helpful. So anyway, Kibby, I think you've got some resources to share.
Yeah, Kate gave us a couple of really good resources that I'll list out, but also you can access them on our website, littlehelpforourfriends.com/episodes. And the main one that she gave us was National Suicide Prevention Lifeline, suicidepreventionlifeline.org. It's 1-800-723-TALK, TALK. The crisis text line is crisistextline.org, 741-741. She also gave us American Foundation for Suicide Prevention, AFSP.org. That's the organization that you said that a follower started to get involved in, so that's a really great one. Another website to go to is www.samhsa.gov. And Suicide Prevention Resource Center, www.sprc.org. So those are a lot of great ones. So if you have a loved one who is struggling, feel free to go to any of those resources and find support, find help, find treatment, anything like that. So don't hesitate. Just look into it. I mean, even if you're concerned, even if you're not sure what's happening, even if you've haven't had a conversation with your loved one yet or don't know what to do, go to one of those websites.
Thanks, Kibby, for sharing those resources, and yeah, just feel free to give any of them a try. Just it always helps to be informed and just a little bit more equipped if you're concerned. So thank you all for listening. I know this is a really difficult topic, but we hope it was helpful. And if anyone is struggling in your life, I hope that you learn something here about maybe where to go for the initial steps for help. So thank you again. Please feel free again to rate, review, and subscribe if you find these episodes helpful. And we will see you next week for a very exciting guest interview. So thanks so much. Bye. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.